Good afternoon. I'm Bruce Gellin from the Rockefeller Foundation. We're here with Mark Smolinski from Ending Pandemics, and we're glad that you could join us today for this look ahead for a world without pandemics. I have to say it's a particular pleasure for me to be having this conversation today with Mark, since I've known him for longer than we probably should talk about. I met him when Mark was at the National Academy of Sciences in the early 2000s, when he was leading the landmark National Academy study on emerging infectious diseases. And so much of what Mark wrote about in that report has turned out to be prescient. And Mark argued for a much more aggressive defense against microbial threats to health, recommended a significant expansion of our early warning systems, particularly in the developing world. Since then, Mark has devoted those last 2 decades to working on this and the building these early disease detection systems in hotspots around the world, pioneered many innovative ideas, what have turned out to be essential tools on the front lines: data, technology, and the participation of the public in disease surveillance, some of the topics we're going to talk about this afternoon. Mark's been a thought leader, an innovator, and a convener of people and ideas for his entire career, and has spent the last several years heading the organization on ending pandemics. So who else would you invite to a topic like this? And through early detection and rapid response to infectious disease around the world, we're going to get there. Mark, welcome. And I'm really looking forward to this conversation. You know, we often talk about lessons learned and how we need to do better the next time. And, you know, those stories are already coming out. Let's start by sort of a look back of what actually have we learned, and maybe give us some examples of things that we learned that are actually playing out now that we are doing better. And then we'll talk about the future.
Great. Well, thank you very much, Bruce, and thanks to the organizers of the Global Philanthropy Forum. It's a pleasure to be here with you all today. So we've learned many lessons over the years, and certainly myself, having worked on several emerging infectious disease outbreaks, I think one of the key lessons that's important for everyone to understand is the lesson that we can't separate human health from animal health, and in many cases, environmental health. So nearly all epidemics and pandemics have been zoonoses, meaning that it's been a spillover event from the animal kingdom to the humans. But really looking at the truly holistic area that we now call OneHealth is really the lesson that we should take away from nearly every epidemic or pandemic in history. Let me just share with you one example. Early in my career, I was on the team that investigated hantavirus when that disease first emerged in North America, mainly in the southwestern area of the United States in 1993. And that's the perfect example to really highlight the interplay between the environment, animals, and humans. So hantavirus was a quite scary disease when it first emerged. It had a 75% mortality rate, mainly people in their young 20s and 30s. It happened over Memorial Day weekend when people went camping or up to their cabins, and literally what happened was they were sweeping these areas out and inhaling the dried urine and feces from the rodents who were carrying hantavirus very sympathetically within their own systems, not causing disease. But the year prior to that was a huge rainy season throughout that entire area, which increased all of the pinon nuts, which are the main food supply for the rodents, which, increased by tenfold the number of rodents in that area. So as these cabins were all closed up and they were living in these areas, when people went back over the holiday weekend and swept it up, they inhaled those particles, and it was a respiratory disease. Like I said, it had an early onset of a 75% mortality rate. But it really showed how the interplay of the environment leading to the changes in the rodent population, leading to then humans coming in contact with that, led to a very scary emerging disease back in 1993. And almost every disease we've been looking at since that time, be it MERS, SARS, even HIV, are diseases that jump from animals to humans. So that's, to me, the real lesson that we need to take forward. I could just share a couple of more. Another really important lesson, and certainly we're all experiencing that here in the United States with coronavirus, is that early detection matters. The speed of detection is not linear to the response. So in other words, finding something, on day 1 versus day 7 versus day 14 doesn't just mean that you're going to have a doubling or tripling effect. It's really an exponential effect. So every moment matters in detecting an outbreak early. And we've gotten better about understanding, that interplay between the environment, animals, and humans across the globe, that we've been able to look at what we call hotspots. So we know where to look and where to focus this ability to find outbreaks faster, but nothing is more important than early detection. And then lastly, I'll just share, and this is clearly a message you hear through most public health issues, not just infectious disease. They're like in the real estate business, they say it's all about location, location, location. Well, of course, for us, it is that as well, but it's more communication, communication, communication. So we need to bring everybody on board with science-based evidence to approach an emerging infectious disease, but open communication about what you don't know and what you do know is critical. And we've learned that lesson through every epidemic.
So those are great takeaways. I think that clearly, as you highlighted, speed matters because it's not linear. So the sooner you get to something, I mean, you're on the West Coast where fires are a big issue, and you want to get it when it's a spark and not it's a forest fire. I think the other thing your hantavirus highlights is it's not just the interaction, but there's the behavior part of it. So maybe those people didn't sweep, they wouldn't run into trouble. But I think that we have to overlay behaviors and understand that as well. So that was the look back and some of the things we've learned. So given where we are now, and everybody's already talking about how we're going to do better the next time, what are your visions for that? Of how are we going to harness not only the lessons from the past, but what we're now seeing, what we're doing, even what improvements we've begun to make, and how we're going to fix these systems in the future so we can actually stop these pandemics before they start?
Sure. Before I get into that, you mentioned that we met many years ago when I was working on the Microbial Threats to Health report with Josh Lederberg and Peggy Hamburg. In that report, we identified 13 factors in emergence. And I can't help but think about this particular event with coronavirus, that 2 of the biggest factors are human behavior and lack of political will. And certainly those 2 factors have really come to forefront in dealing with this particular pandemic. But moving forward, what we've learned, and certainly at Ending Pandemics, we work in countries across the globe. And one of our lessons that has become very evident is that no community is too hard to reach. No country is too poor to innovate. And certainly curiosity outshines fear everywhere that we've been able to work. And some of those have really led to really interesting, creative ways to really change the paradigm. So when we think about the idea that we must integrate our environmental health, our human health, and our animal health, one of the best ways to do that is to directly engage the community. So putting the public into public health has really helped us think new and creatively about how we increase the speed of detection, but equally important in places where we've built these systems that are two-way, so people are the eyes and ears in the community to help us find these outbreaks faster. In those systems, then they're also able to respond immediately because the communication back to the public is at equal speed. So that is something where moving forward, we really see the opportunity that as we build systems that directly engage the community, either the general public itself or surrogates for the general public who know what's happening in the communities, like community healthcare workers, pharmacists, nurses, schools. There's so many opportunities to really make that direct engagement. And like I say, the two-way ability to not only help us with the speed of detection, but increase the speed of response is really going to change how we think about moving forward and moving to a place where it will be possible for us to identify outbreaks faster. And in fact, in many cases, when we engage the right communities and we think about all the people who are out there looking at environmental health and animal health, we should be getting better at even thinking about monitoring and forecasting where we can predict where areas are likely to emerge and think about stopping outbreaks before there's even a human case.
So is that like crowdsourcing an epidemic?
Absolutely. Not only crowdsourcing the community to help with that, we've also worked in areas where we've crowdsourced the epidemic intelligence in a community. So I remember back at a conference where the World Health Organization presented data back in 1990, I think it was. And they were showing that across the globe, the major outbreaks that they responded to, so this is a small set of all of the outbreaks that occur around the globe, but these are ones where WHO participated because they were big enough where they needed help in a particular area. And on average, it took them 15 days to detect an outbreak, but there was an additional 7 days to verify that that outbreak was real before real action happened to move the community towards that response. So we're also crowdsourcing epidemiologists across the globe, no matter what sector they work in, private, public, who are volunteering their time, so that as we've gotten better with systems that are looking at outbreaks through electronic data, we call it digital disease detection, these epidemiologists are now on the ground and able to verify that an outbreak is real, and we reduce that 7 days down to less than 24 hours. So crowdsourcing is important in many elements of what we're trying to do to end pandemics.
I want to ask you about OneHealth in a second, but going back to your citizen epidemiologists, what kind of receptivity do you get? How do you convince people that they can contribute? It seems that they might not realize that they have an opportunity to actually make a difference.
Yeah, it's not only engaging the community, but it's also working with the governments to create systems that they own themselves, because that's part of the battle in recruiting people to be a citizen scientist, if you will. It's got to be a system that they trust. And in most countries, we know that the government is responsible for disease surveillance. So the way we approach things at any pandemics is we partner directly with the government, whether they have resources or technical capability. That's irrelevant, because we will help with both of those areas. We're able to bring catalytic funding to try new innovative ideas, but the government must be sitting at the table from the beginning. And we have a process called an EpiHack, which, having attended several of the sessions here at the Global Philanthropy Forum, we've heard a lot of calls for how do you directly engage the communities. Well, this is an approach that we've developed over time, where when I was at Google, working with engineers and creating Google Flu Trends, the engineers taught me, don't tell us what you want, just tell us the problems you're trying to solve. So I've taken that to heart as I move forward after Google to school. And we bring together technologists from the country in the private sector and the public sector to sit together with the government health authorities, both human and animal. And over a week-long process, the health authorities just talk to the technologists and explain all of the challenges that they have and what they wish they could do, what they wish they could see. And then they take the technologists out in the field. And since we work in a OneHealth environment, they go to wet markets, they go to farms, they go to clinics, they go to hospitals, they go to the health centers. And then they hack away over the course of the week, side by side with these health authorities. So by the end of the week, we have prototypes that have been created by the government officials with technologists from their own country, created in an open source environment so that they own it, they can change them over time, and they promote these tools to their populations because, quite frankly, there's a pride of ownership. And so it's not like the old days where we would build things and try to, export them or import them into hotspot countries. Now we're able to work directly with technologists and the health authorities in these hotspot countries so they co-create their own solutions. And that's how we're seeing the massive uptake. I'm
guessing when you bring these people together, they're meeting for the first time, which sounds fascinating. Do they last? Do they go? They last beyond this field trip? And I made an example of how that's paid off.
Yeah, it's been amazing that we can't even count the number of technologists who have gone on to get a master's in public health after they've interacted in one of these EpiHacks, because they've been so moved by what the health authorities are doing, as well as many of them have maintained long-term relationships with their governments, and the governments have continued to do many different things. Cambodia is a perfect example where the Epi hack that we had there, the Ministry of Health challenged all the developers that this was built maybe 4 or 5 years ago, and there was 14 million people living in Cambodia, and they wanted this system to be able to engage all 14 million people. So obviously the literacy rate is not equal amongst all Cambodians, as well as the access to technology. So the end result was building a system that was a national hotline that works with a simple phone on the wall with a dial-in and voice activated menu, as well as a smartphone, as well as a web-based application. That system has been operating for 4 years and receives 600 phone calls on average a day, and 20 to 30 per month are true human health or animal health events that require direct action by the human or the animal health authorities. When COVID rolled around, and that's what's the beauty of building systems that work every day, that when there's an emergency, they scale up. That hotline in Cambodia started receiving 18,000 phone calls a day, and 90% of all the cases of COVID in Cambodia came through the hotline. But more importantly, it was the primary vehicle for the government to communicate the control messages to the population through that hotline. So that's what's really exciting to see about building these systems that help with, endemic diseases and health threats that happen in localities all the time, but then having them be able to scale immediately. And also, the private sector played a really important role in that. So, we went to the telecom companies in Cambodia, and all 4 of them collaborate so that the system is entirely free. It doesn't matter who your provider is or what device you have. Anybody in Cambodia can use this hotline, and it's free to all the citizens. So those are the kinds of things that are happening around the globe that are really exciting.
That's great. I've been on those lines where it seems like 18,000 other people are trying to call and they're ahead of me. But let me dig into OneHealth a little bit, because I think, frankly, that's one of the areas I think it scares people off. It's so vast. It's so big. There are a lot of animals in the animal kingdom, and this interface of humans, animals, and the environment. So maybe give a sense of how you approach that, how you break it down, and how you make this practical to make the progress that we have.
Yeah. I think sometimes we think OneHealth is too big because, we've siloed everything, especially here in America, into human health, into animal health, and even in animal health, we've separated, wildlife from livestock and domesticated animal. And environmental health, really is the third leg of the stool that still, needs to be brought into this community in a much stronger way. But when you think about from the community's perspective, and one of the systems that was the first one that we partnered with Chiang Mai University in Thailand to create what's called the Participatory OneHealth Disease Detection System, or PODD, which actually PODD is a Thai word that means look closely and you will see, but it's also the acronym. And from a community level, they don't separate it the same way we might when we think about things from a health authority and dealing with disease outbreaks. So for them, the health of their family, their children, their animals, which are their livelihood, their water supply, their food supply, all of that is something that they think about on a daily basis. So when you build tools that enable the community to interact with its health authorities in both the human and the animal sphere about any issue that happens, we went from a system that was designed so that we could find outbreaks faster in the community to something now that the community is using not only to report diseases in humans and animals, but in Thailand, they report counterfeit drug sales in their community. They report food and water quality issues. And, a really simple example of how these things pay for themselves is the single first case of foot and mouth disease was reported in a rural area in Thailand, which led for the first time the vaccination of the cattle in that community. And that was estimated to have saved $4 million from preventing the ban of the exportation of their milk for the many months into the future. So from the community perspective, OneHealth makes sense. It's just really something that, we need to break down those silos and how we think about things from a authoritative or responsibility from dealing with these as health authorities, but from a community level, OneHealth is just their natural way of thinking.
Could you, talk a little bit more about this participatory OneHealth program? And the spoiler alert, I won't do it, but people should go look at they have the coolest logo that tells the story. But it won a great prize on innovation from the Trinity Challenge. Can you talk a little bit more about that one and how that might be a model for what you or what others might do in the future?
Yeah, we were really thrilled. So out of 340 programs from over 61 countries, the system in Thailand did win the grand prize for the inaugural Trinity Challenge, which was great for us because that is our longest running program. And the way we're able to think about building these systems and have them replicate is, Thailand we chose, quite frankly, because we knew they had a very high penetration of mobile phones. So, whenever you're doing an experiment, you have to control a lot of variables, and it was going to be difficult enough to think about for the first time engaging a community to directly report things from the environment, the humans, and the animals. So we went to a place where we knew that we had the technical capability to do that, to overcome some of the other challenges. But Thailand belongs to the Mekong Basin Disease Surveillance Network. So it is in a network that includes the southern provinces of China, but Vietnam, Laos, Myanmar, Cambodia. And so building something that works in one of those countries within a network is a great way for that to foster innovations in other countries. The same reason we chose Cambodia to do the hotline was for the same, Mekong Basin Disease Surveillance Network. And I'm happy to say both China and Vietnam are now looking to replicate the hotline. So it really is getting the communities themselves to be actively involved in designing, prototyping, and then owning this technology is the way that we can have this become not only sustainable, but scalable during times of emergencies, because it really is that local ownership. And everything that is created in an EpiHack, even from developers who come from the private sector, they sign away any intellectual property rights. So it all becomes open source. So it's very easy for another neighboring country or a different community to take that's tools that have been developed in this process and adapt them for their own use.
With the audience of this forum in mind, it seems like this is models like this, or some maybe even adjustments could be things that could be replicated. Is that something that philanthropists could look at of trying to think what they can bring to their country, their region?
Yeah, absolutely. I've had the privilege of working for 3 different philanthropies, and there really is something magic about philanthropic dollars, because in many of these countries, especially when you talk about doing things in the OneHealth sector, and as well as doing things that cross national boundaries, those kinds of things are just not budgeted for the way budgets are set up in individual countries. So for someone to be able to bring catalytic dollars that, quite frankly, are risk adverse, or they're much more likely to accept the risk of trying something innovative that might fail, that's very hard to do with very limited governmental dollars. So the fact that you have that flexibility, you have the ability to innovate, you have the ability to reach out and bring in the private sector to work with the government sector, which is often something that's hard for governments to negotiate on their own. But also, as philanthropists, you have the opportunity to make a commitment for the long view. And so, these systems that we're talking about, we didn't create those overnight. The PAWDD system in Thailand, that was a 5-year effort and a commitment by us to be there to help them, see that through until it was sustainable and scalable long term. And the same thing for the hotline in Cambodia. So, that's something I think philanthropists sometimes fail to recognize, is the fact that they really do have the unique ability to go in and do something and be there without the changes of administration or term limits or things that happen within governments. And it takes a while. These things, they're really exciting when you see the final product, but it really does take that long-term commitment and that flexibility of those innovative funds to make it possible to try some really creative things that ultimately then, because the government's part of that at the beginning, will then be adapted and taken forward when they are no longer such a high-risk idea, but they're a proven methodology.
Now, clearly, there's probably not a philanthropist that doesn't have catalytic in their vocabulary in the first paragraph. But I think this discussion has inspired a question from Sarah Asfar from the Asian Development Bank, and I'll put it in terms of sort of collaborative funding, or what's the role of the multilateral banks in this, in terms of how they might play in and how you would source resources from various places.
Yeah, that's a great question. So in the process that I described in the EpiHack, what we do in any given country is on that first day when the health authorities are sharing their hopes and dreams with the technologists who are going to work with them over the course of the week, we also broaden it out to the entire community in that country. So we usually run ads in the paper. We make an announcement that this week-long process is going to happen so that we get other donors from, in this case, the Asian Development Bank, the World Health Organization, the World Bank, other philanthropies who might be working in that country and other sectors. And then we invite them back on that final day to see what the outcome of the EpiHack was and what tools the government is going to be moving forward with. So it's really an opportunity to broaden the impact of those tools by allowing, anybody within the broader community to be there right from the beginning and see and get excited and hopefully join in, as the Cambodian example, with all the telecom companies coming together to make that tool possible to be entirely free.
Great. Well, I knew this was going to run long. I have an eye on the clock, but I think that since there may be some more time before they bring the finale in with Samantha Power, but I wanted to go back to some of your principles, Mark. You talked about the bringing in the population. You talked about OneHealth. Tell us your sort of the grand vision and what the pieces of this puzzle are.
Yeah, great. Thank you very much. And for those of you who don't want to take any notes, I'm happy to say that the Stanford Social Innovation Review is publishing an article in next month's November edition that highlights the 5 priority actions that we believe will take to end pandemics. And so we've talked a lot about the first one, which is directly engaging the community. That's absolutely critical. The second one is taking a One Health approach. And that's not only in directly engaging the community, but it's in all aspects of pandemic prevention. The third one is expanding epidemic intelligence. And so we talked about some of the crowdsourcing of the epidemiologists who can help verify some of the signals, but we're also working within countries to improve their ability to digitally detect outbreaks by, building systems that scrape the electronic media in the local languages, know the different customs, and are able to detect early threats faster. And we're building those into opportunities where that data is being shared directly with the human health authorities and the animal health authorities at the same time. The fourth area is really helping countries collaborate with each other. We've been working together with several other foundations to support an organization called CORDS, or Connecting Organizations for Regional Disease Surveillance. And that brings together regional networks from different parts of the world to not only foster better regional collaboration, but to create opportunities to collaborate across the globe. And then last, but very important, is to measure progress. And so we've spent a great deal of time over the last decade thinking about how do we, in an area where prevention is often hard to measure because if it doesn't happen, how do you prove that you made a difference? So we came up with the idea of, why are we measuring really simple things with every outbreak, including the time to detect the outbreak, the time to communicate something's happening, the time to verify the threat, the time for laboratory diagnosis. So in the end, we came up with 11 metrics that we have piloted in 28 countries where we looked retrospectively for 5 to 10 years and now built them in their systems to record that data prospectively, automatically, and had 2 international meetings with countries from across the globe, including OIE, FAO, and WHO. And now these simple set of metrics are really being built into programs at the World Health Organization, at the US CDC, and within many countries, so that they can look at progress, so that, yes, we don't want outbreaks to be happening at a large scale, which sometimes are the only ones we really analyze to say, did we make a difference? But every single outbreak, we have the opportunity to see, are we getting faster at finding them? Are we getting faster at doing laboratory? So these performance metrics help any individual country monitor their progress over time. And so that's our fifth priority action.
Well, Mark, your energy for more than 20 years is, I don't know how you keep doing it. And if you keep doing it, you're going to put yourself out of business, but maybe on ending pandemics when you can declare that they're over. I don't think that's going to happen anytime soon, but I mean, thanks for all your insights and all your work on this. And I hope the audience has seen where they can follow up here, and how the particularly the philanthropic investments can really start to move things along in a way that others can't. So thanks for that conversation, and really thanks to the forum for featuring this important topic, because we all want a world without pandemics, and we'd have to start by finishing up the one we're on now. Thanks, everybody.
Thank you.